Hi, I'm Dr. Jacob Witer here at Witer Family Dentistry, and in our office, we tend to get a lot of questions about dental crowns. So today, I'd like to answer some of those questions for you to give you a better understanding of what they are. A dental crown is kind of like a helmet for the tooth, kind of like this, okay? Its job is to go over the tooth and protect it while it functions when you chew. While there isn't really a great alternative for a dental crown, in some cases, a large filling could be done on the tooth. However, that's not really the best long-term solution for the tooth because it really doesn't protect it from the stresses of chewing over time. Dental crowns can be made from a few different materials. Ceramics, metal, gold is a good material. We like to use the stuff that looks good and feels good. It's an all porcelain, all ceramic, full zirconia crown. Generally, after a tooth has had a root canal done, it's a good idea and it's often necessary to put a crown on the tooth to protect that tooth long-term from chewing. When a root canal procedure is done, in order to get access to the nerve to treat it, a lot of times the tooth is then weakened when we bite on it. So protecting that tooth to serve long-term, we put a dental crown on it. The procedure itself to get a dental crown is really a simple procedure. Number one, we don't want you to feel any pain. That is priority number one. The second thing that we need to do is just create the space for the helmet to go over top of the tooth. We do that by just reducing a little bit of enamel away from the tooth and taking a scan so we get a proper fit and something that feels good and looks good. Getting a dental crown placed on a tooth really shouldn't hurt at all. Maybe a little minor sensitivity that is real quick, but that is all. For kids, we don't usually use the same type of crowns that we do for adults. Now, kids, we put stainless steel crowns on baby teeth, and the purpose of that is to keep the teeth where they are, to keep the space for the adult tooth to come in. Oftentimes, if a baby tooth is lost too early, that space can crowd, and then it's a bigger, much more difficult job to get the space open up so you can get an actual size tooth in there or allow the adult tooth to come in. The good thing about the crowns we use today is that they look and feel just like your normal teeth. Now, as far as a tooth that has a crown on it, you can still get decay underneath the crown. Now, the crown itself is porcelain, so that will not get decay. But in between and underneath that crown, that is still natural tooth, we still have to maintain and protect because that could be subject to getting dental decay. Taking care of your dental crown is pretty simple. Always brush 2 times a day, get around those margins right at the gum line. Use floss daily to take care of it. We just don't want any accumulation of plaque or bacteria where the crown meets the tooth. Now, a crown should last you a very long time, as long as it's properly maintained and you visit your healthcare professional at your regular interval. We've seen that most insurance plans do cover a portion of the dental crowns. Now, if you think you need a dental crown or if you have any further questions and would like some more information, you're welcome to give our office a call. Phone number is 586-281-3266. Or you can click the link below and schedule an appointment for a free consultation. Thanks, and we'll see you there.